1 year ago today, System leaders officially opened the Roy Blunt NextGen Precision Health Institute. In our series, Push for Precision, last year we showed you how the System paid for the project and the lofty expectations for what MU leaders believed in the future of medicine. Tonight we'll take you inside the doors and show you what's happened over the past year. KOMU8's Avery Everett joins us now live on MU's campus with a look at what's next for the System's biggest priority. Avery.
I was here last year on opening day when this plaza was packed with hundreds of people. Now they're all inside, helping to push research forward that's putting MU on the medical map.
We shouldn't ignore the data. Look at here.
In the lab of Dr. Isma Yolku.
And I'm wondering, what is this population?
Hope is harbored in every experiment.
Here at University of Missouri, we have that opportunity.
In her research for treatments of autoimmune diseases,
we tried 99 times, fails, and just one time, it works.
Yolku says her work in cell therapy is constantly changing. But her team finds stability inside the Roy Blunt NextGen Precision Health building.
I felt like, I am a kid in a room full of toys.
Just down the bench is Dr. Haval Sherwan, a leading researcher and husband to Yolku. They're a team tackling treatments for type 1 diabetes and making progress in it too.
Our knowledge, especially in health sciences, is just the tip of the iceberg.
Their research has more than 20 years of roots, but their time in the NextGen building is only at 1 year. From an idea to an institute, System President Moon Choi says the NextGen building has beaten expectations.
That hope has turned into reality.
KOMU8 filed a public records request to see how many grants NextGen researchers have brought into the System. Since the start of October last year, a summary of those grants roughly adds up to about $100 million. From a mix of existing faculty and new hires, Choi says progress within the NextGen initiative is campus and community-wide.
I believe the results are happening all around us.
Like just down the road at MU's Animal Science Center. Randall Prather genetically engineers pigs to use their organs in transplants and research. He's not a direct researcher under NextGen, but he sees the scientific importance through a different lens.
She was my best friend.
The health of his wife, Jamie.
Dad, it's the longest goodbye.
Jamie was diagnosed with dementia just 5 years ago, and there is no cure.
So that's where we're at in terms of treatments. For where she is, there really aren't any.
He says prescription medicine helps, but it doesn't heal.
But you do it because you don't know. Maybe it is helping.
Alzheimer's disease is being studied at NextGen, but no human trials are being conducted in the building just yet. Prather says it's a necessary next step, even if his family isn't the one to see it through.
I know that when my wife passes, she'll be in a better place. And I know I'll be there sometime too. That's the hope.
That's good.
Sherwin says stories like the Prather family fuel the work happening inside the Institute.
What we do is really meaningful and it's important.
In a building that had expectations bigger than the build itself, NextGen researchers aren't just hoping anymore.
I am excited. I'm really excited.
They say they're on their way to find treatments that tackle those conditions without a cure. Those doctors were some of the first researchers to actually start working inside of NextGen last fall. Now this story isn't over. Tomorrow night at 6, we'll take you into the 3rd floor here at NextGen and show you the clinic space that's opening in the coming weeks. Reporting live in Columbia, I'm Avery Everett, KOMU8 News.